Hey guys, Ken McDonald from Lifetime Performance. Today I'm going to talk to you a little bit about back pain and how to relieve it with this lacrosse ball. Okay, we're going to be talking a little bit about the QL, or the Quadratus Lumborum. If you do have back pain though, I suggest first you go to a medical expert, a physical therapist, a doctor, just to rule out some other issues. It could be nerve related, it could be issues from a herniation or facet joint problem. But today, like I said, we're going to get into a little bit of some soft tissue techniques you can use to help alleviate some of that pain that's typically located in the lower right-hand area of the lower back, which is a very common area for golfers. And obviously, you might be able to feel it when you rotate side to side, getting a little bit of that digging, that grabbing back into there. But the QL muscle in itself does a couple different things. One, it hikes the hip up like so. It will also side bend us. Bilaterally, it will work to extend our back, okay? And it can become inflamed. So with this lacrosse ball, I'm going to show you how to release that QL area before you do anything else. And just actually releasing it should get it to calm down, should make it feel a little bit better. So we're going to use, if you're at home, you can use an ottoman. I'm just going to use our box here, and like I said, a lacrosse ball. What we're going to do, we're going to lie down with our feet up at about a 90-degree angle. We're going to place the lacrosse ball, and this may be tough to feel, but just below your bottom or 12th rib, and just above the top of the pelvis, the iliac crest. We don't want it to be on any bones here. So we're going to place it right in that soft tissue area, and you're going to place it right on the side so there's not a lot of pressure. Now once you find that area, that soft tissue area, I'm going to ask you to roll into it slightly. You're going to feel a big difference when that ball is in that right spot. It's going to light you up a little bit. What I want you to think about doing is just controlling your breathing. We're going to take a deep breath into the nose. You're going to feel a little bit more pressure on the ball as you inhale in, because ideally we're getting that air down to the diaphragm and we're breathing three-dimensionally. And as we exhale, the abdominals are going to engage slightly. I don't want you to forcefully engage them, just let them do their job. As we exhale, we're going to exhale out the mouth and try to totally relax. Inhale through the nose, exhale out the mouth. You're going to continue this pattern for 3 minutes. Okay, if after 3 minutes it may feel a little bit sore through there, but we're going to go into a stretch to follow that up. Okay, so we're going to not need our lacrosse ball for this one. We're going to get on our side. We're going to straighten out our right leg. We're going to take our left leg, place it over here. We want to make sure that our pelvis rolls over and that we're nice and straight through here. Now this may be a stretch in itself for you. Okay, just prop it with the elbow, but I want to take it up a little bit. We're going to take our weight out under our hand and use the arm to push into the floor and to lengthen our right side here. So we'll feel a big stretch down through the rib cage, through the side of the pelvis, and obviously the soft tissue area we just worked on. So we want to release the area first, and then we're going to stretch it out a little bit. You can hold these stretches for about 10 seconds, then relax, and then we can come back up. Do about 5 to 6 sets of 10-second holds. Get up, walk around, see how it feels. So just to review, we use the lacrosse ball, feet up on the ottoman, place it on the side, and then roll onto the ball so we start to get a little pressure on that spot. And then we're going to follow it up with a stretch. About 10-second holds, 5 to 6 sets. Get up, walk around, see if it feels a little bit better. Again, if it is an issue that is not a QL problem, obviously we want to get checked out, but this can help relieve a lot of those issues that just creep up through overuse of swinging a golf club too many times, that sort of thing. So give it a shot. I hope it helps.